Great. So Adrian, if you could just go to the next slide for me.
Okay.
So tonight we have with us Adrian Fisher. She is a nurse practitioner with Bay Health, general and colorectal surgery. She has nothing to disclose about this presentation. Next slide. And before I turn it over to her, I just wanted to introduce who we are as Cancer Support Community Delaware. We are part of a national organization, and the mission of our national organization and our local affiliate here in Delaware is to ensure that all people impacted by cancer are empowered by knowledge, strengthened by action, and sustained by community. And we do that through our support groups, our healthy lifestyle classes, and then educational seminars like tonight. So without any further ado, I will turn it over to you, Adrian, for our colorectal cancer presentation.
Thank you so much, Erica, and thank you for the opportunity from the cancer support community to present tonight about colorectal cancer. All right. So let's talk a little bit about what colorectal cancer is. It's cancer that starts in the colon or rectum. It's the third most common form of cancer in men and women in the United States. Rates among young adults continue to increase, although over the last 20 years, due to improvements with screening, diagnosis, and treatments, colorectal cancer deaths have decreased. And the best way to prevent colorectal cancer is through screening and removing polyps early. So what are some signs and symptoms of colorectal cancer? Oftentimes people don't have any symptoms at all until colorectal cancer becomes more advanced, but some people may experience change in bowel movements, so that can be constipation, new diarrhea, new feeling of never, being able to completely evacuate. Stools can be narrower, and then other people have blood in their stool. It can be dark colored, or it can be bright red. Abdominal discomfort, weight loss, for unintentional weight loss, constant fatigue, vomiting are all can be signs of colorectal cancer. But again, screening is really important because a lot of people in the early stages don't have any symptoms at all. So colorectal cancer, typically you'll see your physician and have a physical exam. If you're coming for symptoms, they may like rectal pain or rectal bleeding, you may have a rectal exam at that time, and they're looking for any tumors that they can see just on exam in the office. But most people need a colonoscopy as well, which is an outpatient procedure. Sometimes they're done in endoscopy suites by gastroenterologists. They can also be done in the hospital. You get IV sedation, so you're asleep and you feel nothing. And then part of the workup for colorectal cancer includes blood tests like carcinoembryonic antigen, which is a substance made by cancer cells. A high level of this, it's called CEA, can mean that the cancer has spread, but it's something that they get baseline after you've been diagnosed with cancer, and they follow it. They trend it through your treatment. And then also part of staging, CT scans of the chest, abdomen, and pelvis help us figure out whether the cancer has potentially spread to other organs. There's other, for rectal cancer in particular, we also use MRIs to locally stage tumors. People that can't have MRIs may have an endoscopic ultrasound instead. but it kind of gives us more information about your cancer. And then surgical resection, we'll talk about a little bit more in some a different slide. There's also biomarker testing, which helps doctors understand which treatments are right for you, and if your cancer is inherited. The tumor removed during biopsy, which would have been done like at the time of your colonoscopy or at the time of surgery, can be tested for biomarkers. There's MSI high, which is microsatellite instability or deficient DNA mismatch repair. This testing is done to screen for Lynch syndrome, which is an inherited cancer syndrome, and that can help guide your treatment with chemotherapy and also, what additional surveillance you may need if you have Lynch syndrome. There's also KRAS mutation analysis, which determines in stage 4 cancer, it helps to see which therapies you might respond better to. So how is colorectal cancer staged? There's 3 factors we look at. It's called TNM staging. T stands for tumor, and that means how far does the tumor extend into the wall of the colon or rectum. And then you also have your node status, which are the cancer cells in the lymph nodes, and then metastasis looks at has the cancer spread to other organs. So through information gathered from your workup, your scans, your surgical pathology, you get kind of the full state. You're able to get a full staging of your cancer. So stage 2 or stage 0 to 4. So stage 0 is cancer is only in the inner lining of the colon or rectum. Stage 1 just means the cancer has spread to the middle layers of the colon or rectum wall. Stage 2, the cancer has spread to the lymph nodes or the cancer has not spread, to the lymph nodes or distant organs. So it's still within the wall of the colon, but it hasn't gone to the lymph nodes. Stage 3 is when it spreads any nearby lymph nodes, but not other parts of the body. And then depending on how many lymph nodes are involved, that determines your stage 3 A, B, C. And then stage 4 is when it's spread beyond the colon or rectum wall to other parts of the body, such as the liver or lungs. And this is kind of an illustration. So you can see stage 0 to stage 4. You're looking at the tumor depth and through the wall. And then once it's spread to the lymph nodes, that's stage 3. And then once it's spread to other organs, that's considered stage 4. So partnering with your healthcare team is imperative in the treatment of colorectal cancer. There's a lot of different people that can be involved in your care: surgeon, medical oncologist, radiation oncologist. Typically for rectal cancer is where radiation becomes applicable. There's nurse practitioners, social workers, nutritionists. Our cancer center has great navigators. Pharmacy may be involved for chemo. Your primary care physician is obviously very important. They also have financial resources that can help you. And then of course, most important part is you and what your preferences are, and communicating with everyone on your team. So preparing for appointments, it's great to have a list of questions or concerns to bring with you. That way you make sure that you get everything answered that you need. You want to tell your healthcare team about any side effects or symptoms that you're having. You also want to make sure that they're aware of all the medications that you're taking. It's always a good idea to bring somebody with you as not only support for you, but also to help take notes or, keep track of details, because these appointments can be overwhelming with a lot of information shared between, you and your healthcare team. And you can always ask for copies of, your test results, or, a lot of um, health systems now have online records where you can, keep track of everything in one place. You can always consider a second opinion. You have the right to get a second opinion, even a third opinion. It's common and accepted. Don't worry about hurting your healthcare team's feelings. We want, you to have the best possible care and outcome for treatment of your cancer. So what impacts treatment decisions? So it really depends on the type and stage of your cancer, the results of all your testing, including the biomarker testing, your age and your overall health. What other medical problems do you have? How have you responded to treatment? And how well you tolerate treatment. There's side effects that to everything, and some people can't tolerate certain medications and need their treatment regimens switched. Okay, so our goals for treatment, for early or localized disease, the goal is to remove the cancer cells, kill the cancer cells, and keep the cancer cells from returning. For more advanced disease, our goal is to slow or stop the growth of cancer cells, manage, quality of life, and in certain, for some advanced cancer, surgery is used to cure patients. So treatment is really defined again by your stage and type of cancer, what your symptoms are, and what your goals for treatment are, and your preferences. And everyone kind of responds differently to treatment. So communicating again with your healthcare team is the most important part, and expressing, what your goals for care are. There's many different types of treatment for cancer. We'll go a little bit more into detail with all of these. And again, depending on your stage and type of cancer, depends on what treatment you may be able to have. So surgery, the goal is to remove as much of the cancer as possible. For colon and rectal cancer, it can either be done laparoscopically, which means you have small incisions on your abdomen, and a camera and instruments are used to take out that portion with the cancer. Open surgery, you have obviously a bigger incision on your abdomen to remove the cancer. Surgery can involve a colostomy or ileostomy. Colostomies bypass part of the colon. It's typically used in the treatment of rectal cancer more than colon cancer, and colostomies tend to have more semi-solid or solid output, depending on what part of the colon is brought out as the colostomy. Ileostomies are also used to bypass the entire colon. It's made up of the small intestine, and its output is typically liquid. Colostomies and ileostomies can either be temporary or permanent, just depending on where your cancer is and what, there's a lot of different factors that play into that. So what are the side effects of surgery? You can have, initially you have pain, and there's risks of infection. You can have scarring and adhesions. Other effects can be fecal incontinence, gas, cramps, or bloating. But talking to your healthcare team about your symptoms and how to manage them is important. Ablation is used to destroy tissue or treat small tumors. It's mostly used in colorectal cancer to treat when the cancer has spread to other parts of the body. So like the liver. So radiofrequency ablation uses electric currents and heat to kill cancer cells delivered through a probe. Cryoablation freezes cancer cells to destroy them. Side effects of ablation therapy can be soreness at the site, pain, liver infection, internal bleeding, and fever. Chemotherapy is systemic whole body treatment that uses drugs to destroy cancer cells. When given, after surgery, it's called adjuvant treatment. If chemotherapy is given before surgery to shrink the tumor, it's called neoadjuvant. Typically, we use neoadjuvant chemotherapy in rectal cancer patients. And then colon cancer patients, it's given, depending on the stage, it's given after surgery. And then there's, different types of chemotherapy. Some people need it through an IV or like a portacath that's inserted, while other people can take chemotherapy in a pill form. Radiation therapy, like I mentioned, it's commonly used to treat rectal cancer. It's less common for colon cancer. Usually in colon cancer, it's for like a locally advanced cancer, but it's most commonly used in rectal cancer patients. And it uses high energy rays to kill or damage the cancer cells. It can be given before, during, or after surgery. And then side effects from that burn, like skin irritations, and higher risks for skin infections, pain and swelling, scarring or blockage of areas, incontinence, and then it can also impact sexual health and fertility. Chemoradiation, given during the same time period, the reason for that is the chemotherapy sensitizes for radiation. So the chemotherapy weakens tumor cells so that they become more sensitive to radiation. And this is used together for the treatment, again, of rectal cancer. So targeted therapies, these aim to attack cancer cells more precisely. They target specific genes or proteins. And so some examples of that are EGFR inhibitors and the VEGF inhibitors block the development of blood vessels that cancer cells use to grow or spread. There's kinase inhibitors, which block a type of protein that helps tumor cells grow, that can help form new blood vessels to feed tumors. And they're typically used to treat advanced colorectal cancer when other drugs have stopped working. They can cause various side effects as well, but you want to talk to your healthcare team about what the treatment options are and what the side effects are. So here are some of the side effects from chemotherapy and targeted therapy. Diarrhea. I've actually had several patients that have really severe constipation while on chemotherapy. Mouth sores, numbness or tingling in the hands or feet, cold sensitivities, fatigue, hair loss, rashes, allergic reactions, nausea, vomiting. Immunotherapy uses the body's natural defenses to identify, attack, and kill cancer cells. There's PD-1 inhibitors, which target a protein on immune cells to help keep them from attacking other cells in the body. By blocking this protein, these drugs can help the immune system fight the cancer cells. And then the CTLA inhibitors keep immune cells from attacking other body cells in the body. It blocks a different protein, and it can be given IV at the same time as some PD-1 inhibitors. but the goal of the immunotherapy is to boost the immune system, mark the cancer cells so that your immune system can better fight and destroy them, and then help the immune system find cancer cells and deliver the treatment directly to them. So managing side effects, the goal is to kind of take control of the side effects before they impact you. So before beginning treatment, it's great to talk to your healthcare team about what can you do and how to manage the different side effects that you may experience throughout your treatment. So bowel issues is something that certainly comes along with the treatment of colorectal cancer. Obstructions and perforations can be caused by the cancer itself. Tumors can perforate through the wall or become so big that they obstruct the lumen so that stool cannot pass beyond it. And treatment can also cause, perforations and obstructions, and symptoms that you want that may be happening include abdominal pain, nausea, vomiting, bloating, unable to pass gas, have constipation or diarrhea, and loss of appetite. Clinical trials. So there's, ongoing clinical trials for a variety of, different treatment regimens. It's how they research and study new treatments or new treatment combinations to see if, we can improve cancer care. But, not every doctor has the same trials available. You kind of have to talk to your healthcare team and see if there's anything that you can be part of. Often the trial will pay for, the drug being studied, but you want to make sure that you ask about if there's any cost for you. And no one receives a placebo or sugar pill in place of appropriate treatments, when you're talking about cancer treatment. And of course, if you join a clinical trial, you can leave at any time. We'll talk a little bit about palliative care. So the goal of palliative care is to improve quality of life for patients and their families. It focuses on providing patients with relief of symptoms, pain, and the stress of serious illness. It's appropriate for any patient at any age or stage of cancer. It certainly does not mean hospice care. It's available for everybody that may benefit. So what does follow-up care look like after you've been diagnosed with colorectal cancer? We use the National Comprehensive Cancer Network, NCCN guidelines to guide surveillance of patients who have colorectal cancer, and it's very much based on what stage you were at the time of diagnosis. And it very specifically lays out, how often you need history of physicals, how often do you need that CEA level checked, how often do you need surveillance scans of the chest, abdomen, and pelvis, how often do you need colonoscopies. So you want to be informed, you want to talk about what your follow-up care plan looks like with your team. And I mean, these are just some basic guidelines. You're going to follow pretty closely with your cancer team, in the first 5 years after diagnosis. So coping with colorectal cancer. Some important topics that probably don't get discussed enough is the impact on sexual health and fertility. Before starting treatment, it's important, to talk to your doctor about fertility. If you plan to have biological children, you may want to see a fertility specialist before starting treatment. Um, Sexual health can also be difficult to discuss. You want to find someone on your healthcare team that you trust and can ask questions about, too. And, this comprises all the feelings and actions associated with, loving someone. So quality of life, again, it can impact your physical health, it can impact your emotional health. You can experience a wide range of feelings, from feeling sad, feeling alone, feeling angry, overwhelmed by, all the information in the treatment plan. But it is possible to find a balance, between getting the medical treatment that you need, but also balancing the social and emotional concerns as well. So some questions you can ask to see if you're experiencing anxiety includes, do you have persistent worry? Are you having difficulty sleeping? Are you feeling nauseous or experiencing an escalated heartbeat? And then questions about emotional wellness, to see if you are experiencing depression. Do you cry often or uncontrollably? Have you lost interest in things that used to give you pleasure? Are you eating and or sleeping more or less than you used to? And if you're answering, yes to these questions, you should definitely be reaching out to someone on your healthcare team, whether it's your primary care provider or, your oncologist, somebody to talk to. And there's lots of other places to get support as well, and we'll cover some of those resources here in a second. But a lot of support can come from support groups, where you can talk to people who have the same diagnosis as you, or there can be a mix of people with different diagnoses. You can, attend support groups by yourself as a patient. You can, there's support groups for caregivers, there's support groups for both. There can be cancer survivor-led support groups, there's professional-led support groups. They can be face-to-face or they can be online. I think there's been a lot more resources come available for people online with the COVID pandemic, which I think is great for cancer patients. So people often find that if they're a part of a support group, they have decreased depression, increased zest for life, a new attitude toward their illness. Other forms of support, there's one-on-one therapy, there's spiritual counseling, there's advocacy. Strategies for wellness: physical activity elevates your mood, combats fatigue, maintains function, and promotes rest. Eating healthy maintains your energy, strengthens your immune system, limits symptoms, and provides comfort. Drinking plenty of fluids avoids dehydration, promotes regularity, combats fatigue. And then creating a personalized care plan helps you set goals, find resources, and use support. And then, caregivers are very important for patients who are experiencing cancer, but they also have to remember to take care of themselves and to talk to others for support. There's mylifeline.org to help with scheduling and communicating with friends and family. It's a great online tool. And then you can also talk to your loved one's healthcare team to find what local support may be available as well. So colorectal cancer treatment, there's a lot of other factors to consider. Finances, insurance, legal matters, employment. Can I work through my treatment is an important, question and concern that a lot of patients have. You want to keep records of your expenses. You may want to work with an attorney to draft a will or a medical power of attorney so that your wishes are known for your family. So the cost of care, asking for and accepting help can be hard. Many families facing cancer have shared with the cancer support community that financial worries about cancer costs are a significant source of stress for them, and they often don't know where to turn. Many people diagnosed with cancer ask someone else for help to keep up with the financial aspects of their cancer care. It's key that someone must address these issues. So two kind of important questions to ask are what are the financial impacts of my cancer diagnosis and cancer treatment? What will they have on my life? And can I coordinate the financial piece of my cancer care right now? So we have great social workers, I know in our cancer center to help oncology patients with this piece. And they can refer to, resources and help with that part. Some important legal documents that may be, worth considering for pretty much everybody, not just patients diagnosed with cancer, but a living will, which is a legal document that states whether you want to be placed on life support if you could not survive without medical intervention. It can also cover your preferences for tube feeding, for water, for medication. And a living will only goes into effect if you can no longer communicate what your wishes are on your own. A healthcare proxy or medical power of attorney, again, it's a legal document that allows you to appoint a trusted person to make medical decisions for you when you cannot make those decisions yourself. Financial power of attorney is you're legally naming someone to make financial decisions on your behalf when you're incapable or otherwise desire assistance with money and finances. And then a will is the legal document that, defines what you want done with your property, with your money, with, other possessions, who's going to care for your children after we die. And with that, I'm going to turn it back over to Erica to kind of highlight some of the resources that the cancer support community has for patients diagnosed with cancer.
Thank you so much, Adrian. And, she's mentioned a lot of great resources already. One of which is your social workers and your navigators and your nurses right in your own cancer centers. They're very useful. At Cancer Support Community Delaware, we do have a monthly colorectal cancer support group. And one of our people in the presentation put in the chat that it really helped her tremendously. So, the support groups are very important and helpful. And also wanted to mention, because resources or the finances of getting through cancer are really difficult, we do have, if you're a Delaware resident, we do have an Insight Cancer Care Assistance Fund that we can help you with. But we are part of a national organization. The national organization provides the material for this presentation today. So the resources available through them are, for one thing, they have a helpline, which you can call, the 1-800 number that you see on your screen. They generally refer right back to the local cancer support community, which would be us, but they are someone that can help you. Next slide, Adrian. And then these are some other, this is their contact information for the national. Their website, ours is cancersupportdelaware.org. And then other cancer organizations that can be very, you can find resources through is American Cancer Society, the Colorectal Cancer Alliance, Fight Colorectal Cancer, and then the NCI, or National Cancer Institute. Okay. And then I believe that Adrian mentioned this one earlier too, My Lifeline. This is, it's kind of like if you imagine, if you're familiar with CaringBridge and Facebook, it's like they kind of put them together. So it's a way to kind of connect with others that have the same cancer as you online, and share your stories, and get on discussion boards and that kind of thing. So if you want more information, I can help you with that. And then we also have something called the Cancer Experience Registry. Essentially, it is a survey that you can fill out. It takes quite a while, for 30 or 40 minutes, and you register an account, and it helps, and you kind of upload information about your emotional, physical, financial, and other things about your cancer experience. I could just go to the next slide. And then what happens is this becomes part of the research for our organization, and it helps us to enhance the care that we provide based on what you, the cancer patients, are saying. It helps us improve our support services, and we also use it to influence healthcare policy. So you kind of get an account, you can go in there and fill out your information, and you can kind of go back and add to it as as time goes on. So again, that's something I can give you more information about if you're interested. And then I mentioned about how that does help us with advocacy. One of the things our national organization does is advocate for patients, for cancer patients. They are at Capitol Hill, they're finding out what's going on, they're making sure they're in touch with our senators and our congressmen, and making sure that things are being passed and our voice is being heard as cancer patients. And you can be, if you visit on their website, you can become an advocate as well for that. And now I'm going to turn it back over to Adrian to see if there's any questions. I am going to stop the live stream. So if you're watching on Facebook and you do have questions, please put them in the comment section, and I will get back to you with the answers from Adrian. And thank you.